I would say the most important thing about what we do is, in essence, saving lives. We are able to assist patients in prepping for a procedure that, by far, statistics prove the success rate of avoiding terminal illnesses.
Colorectal cancer is one of the leading, most preventative forms of cancer. And a lot of the reasons that people don't do it is they get scared.
Someone could treat it just as a job, but here we actually have the ability to improve the quality of individuals' lives and even extend their lives if we do our piece of the puzzle correctly.
How do we make sure that these people are actually getting what they need and that they're not just treated as a number in the system? And to me, it's a passion to make sure that we treat people the way that they deserve to be treated.
Many people say, treat others how you want to be treated. I take it a step further and I provide the service that I would want given to one of my loved ones.
Each patient should be looked at like they're your own grandmother or grandfather.
How would I want them treated? What level of service would I want them to be provided? And that helps me to go a step above what may be normal or required because I want to make sure that I take good care of them.
Just willing to go the extra step. We've had occasions where patients want directions of how to get to the practice, even if you have to Google map it and give them the directions. I think that's an extra mile that a lot of patients appreciate.
There's no time limit on the call. We're not trying to get them off the phone to get to the next call. We've had little grandmothers call and they want to talk for 25 minutes and really understand every intricacy of what's going to happen. And their goal is really to listen and make sure that they're informed and they feel comfortable.
If you are really thinking about the person and listening to them, sometimes they don't even want the advice, they just need somebody to listen to them.
The most important thing is getting the patients to trust us.
The importance of my role is making sure that our company is providing valuable services to their practice. If you consider mailing, sending out prep instructions and information to the patients, that takes a lot of time and work for their staff, so we have our shipping department.
What we do back here is we package kits for the patients who are about to go into their colonoscopy. So what these packages does is it cleans them out for the procedure so the doctor can get in there and take a good look at them.
And also the phone calls is a big thing. We take on thousands of phone calls per day that would originally be going to the practices.
And I think our entire team here, number one, we care about our patients, but we care about our people as well. And I think that shows. They work really, really hard back there. So what are the things that we can do to make their jobs easier?
Working here is like an extension of home. We hear that all the time, but to actually be with a company that embodies that, it makes it a joy. I enjoy the people that I work with and the position that I hold, the tasks that I get to do throughout the day. I feel that we've succeeded when I hear other employees say the same thing.
The fact that the executive team, everybody here's done the jobs that they're doing. When we started the company, almost every conversation that they could have, we've probably heard. I mean, we know what they're going through. At the end of the day, no matter what, it's a people business. I think it's hiring good people that are empathetic and truly care for the patient. So it starts with good people, it starts with good training, and then it starts from basically our mission and core to serve. It's exciting because I think we're taking a different approach in healthcare that is needed. So at the end of the day, more people are getting screened. They're sticking with the procedure, and we get really good customer feedback saying that they felt comfortable. It's never as bad as they think it's going to be, and we're getting a lot more people to follow through, which means in our world, we're impacting colon cancer.